Hi everyone, my name is Shridevi, working as a lecturer at Department of Nursing Foundation, Yenepoya Nursing College. So today I'm here to give a brief idea or lesson about hospital acquired infection. Okay, shortly it is called as an HAI. Let us see the learning objectives of today's class. At the end of the class, learners will be able to understand the meaning of hospital acquired infection, identify the sources of infection, enlist the mode of transmission, list down the causative organism, enumerate the types and symptoms of hospital acquired infection, and explain the preventive measures for that. So let us look into the introduction part. Hospitals are the places of healing, but for many patients they can also become a source of unexpected infections. So these infections are known as hospital acquired infection, or also called as a nosocomial infection, pose a significant threat to a patient's safety and public health. So what is the exact meaning of nosocomial infection or hospital acquired infection? It is an infection occurring in a patient in a hospital or other healthcare facility in whom the infection was not present or incubating at the time of admission, which means the patient might have come to the hospital for any therapeutic or diagnostic purposes where patient was not having any sort of infection, but after the admission during the treatment phase, patient might acquire a new infection. So that infection is called as an nosocomial infections. So when it is diagnosed as nosocomial infection in the sense, when a infection occurs after 48 hours of hospital admission and 48 hours of discharge and 30 days after an operation. If a patient is undergoing surgery, after 30 days of surgical procedure, if a patient is encountering any infections, so those infections are considered as hospital acquired infections. So let us see the sources of hospital infection or nosocomial infection. Okay. So first one is endogenous source and second one is exogenous source. So first one, endogenous, as the name itself suggests, endo means something within or inside. Okay. So these type of infections are caused by the organisms that are present as a part of their own flora, which may invade the patient's body during some surgical or instrumental manipulation, which means typically the bacteria will be present in the body itself. So whenever the immune system weakens or deteriorate, these bacteria grab an opportunity and it will cause an infection. That is called as an endogenous source. Okay. Example, Staphylococcus bacteria live harmlessly on the skin. When the immune system weakens, it enters the deeper tissue and can cause abscess. This is an example for endogenous source. Second one is exogenous source. This type of infections are caused by the microorganisms acquired via exposure to the hospital environment, healthcare professional, medical devices, and cross-infection from medical personnel. In the sense, when the patient is exposed to the hospital environment, or when the patient is having or coming in contact with the medical devices which was used for another patient, and if it is not disinfected properly, then that is a source of infection, that is a source of exogenous infection. In this scenario, the patient will not be having any infection, but the patient's surrounding will be having infection. Okay, when the patient comes in contact with these surrounding, he might acquire a new infection, that is called as an exogenous. So this picture you can see, first one is self-infected. Normally the microorganisms will be present in the skin or anywhere in the body. Okay, so those microorganisms, when the immunity weakens, these will attack the body and can cause infection, that is self-infection, that is endogenous. Okay, whereas cross-infection and environmental factor, these two comes under exogenous. So far we have seen the sources of infection. Let us see the mode of transmission. Transmission in the sense movement of microorganisms from one place to another place. Okay. So first one is contact transmission. Contact transmission can be divided into two subcategories. One is direct contact, second one is indirect contact. Direct contact in the sense physical transfer of microorganism between a host and an infected person. Okay, when a person come in direct contact with the infected person, that time he will acquire a new infection, that is called as a direct contact transmission. Second one is indirect transmission, which means when a person come in contact with the contaminated objects such as instruments, needles, gloves or dressing, then these cause a source or a mode of transmission for a host person. Second mode of transmission is vector-borne transmission. These microorganisms are transmitted through insects and other invertebrate animals such as mosquitoes and fleas. Third type is airborne transmission. This involves the transmission of microorganisms through small droplets or particles that remain suspended in the air and can travel long distance. For example, when a patient is acquiring any infection, okay, so these infection need not to be transmitted only by the direct contact, okay. These microorganisms can be suspended in the air also, okay, and when a host or a new patient is exposing to the same environment, he can also acquire a new infection. That is called as an airborne transmission. Fourth one is droplet transmission. This occurs when the microorganisms are transmitted through the large droplets that are expelled during cough, sneezing or talking, okay. When an infected person is coughing or sneezing without protecting or without covering his mouth, so there are chances of spread of infection from the infected person to the host person. So these four are the mode of transmission for hospital acquired infection, okay. So far we have seen the sources and mode of transmission. Let us look into the causative organisms of hospital acquired infection or nosocomial infection. So first one is bacteria, okay. Bacteria, there are two types of bacteria. One is gram-positive bacteria and gram-negative bacteria, okay. Under gram-positive bacteria we have Staphylococcus aureus, coagulase-negative staphylococci, Enterococcus species comes under gram-positive bacteria. Gram-negative bacteria includes E. coli, Klebsiella pneumonia, Pseudomonas aeruginosa, Acinetobacter baumannii. So these are the bacteria which comes under gram-negative bacteria, okay. So any one among these bacteria can also contribute for nosocomial infection. Second one is fungi, Candida sepsis. This is the most common causative organisms for urinary tract infection in hospital setup. Third one is viruses, influenza virus, respiratory syncytial virus, shortly it is called as an RSV, hepatitis B and C. Fourth one is parasites, Toxoplasma gondii and Giardia lamblia. These are the two parasites which is causing nosocomial infection. So far we have seen the causative organisms. Let us see the different types of hospital acquired infection. First one is central line associated bloodstream infection, shortly it is called as an CLABSI. Second one is catheter associated urinary tract infection called as a COTI. Third one, surgical site infection called as an SSI. Ventilator associated pneumonia, shortly called as an VAP. And fifth one is methicillin resistant Staphylococcus aureus, shortly it is called as an MRSA. So these five types are the very prominent type of nosocomial infection or hospital acquired infection. Apart from these major five, there are few more infection such as skin and soft tissue infection, gastroenteritis, sinusitis and infection of the eye and conjunctiva, endometritis and other infections of the reproductive organs following childbirth, okay. Let us look deep into one by one. First one is central line associated bloodstream infection. So bloodstream infection makes up to 14% of all HAIs when a bacteria or a fungi enters the bloodstream through the central line, leading to systemic infection and potentially life-threatening complications such as sepsis or septic shock. Usually when a patient is admitted to the hospital for a variety of reasons, we will assess the patient condition and we will do the needful, okay. Example like delivering blood and body fluids, okay. When you want to infuse or when you want to deliver body fluids, we will deliver it by means of cannula, okay. In case of acute condition or when a patient is in a critical stage, we use a device called as an central venous catheter, okay. So when this central venous catheter is not taken care properly, that might lead to central line associated bloodstream infection, okay. So this picture shows the central venous catheter, okay. This is placed in case of very critical examples such as a patient have met with a road traffic accident. In order to infuse or in order to deliver a large blood products, we will use it, or patient who is receiving a dialysis care, or patient who is undergoing any other major surgery. In case of that, we will use it. Or a patient, onco patient, when they are receiving chemotherapy also, we use the central line. Okay. So how can you identify the patient is having CLABSI, or the patient with the CBC may have an infection? Okay. So some of the signs and symptoms the patient will start to exhibit, such as fever and chills. Okay. So fever, when it occurs, in the sense whenever there is a presence of bacteria in our body immunity or immune system will identify that, and it will try to destroy that by increasing the body temperature. Okay. So that the patient might manifest fever. So second one is hypotension, that is low blood pressure. Patient will be having low blood pressure, tachycardia, fast heart rate or increased heart rate, you can tell it as. Redness and warmth or pus at the incision site, okay, where the catheter is inserted, right, in that area you can see the redness or discolorization you can see. Okay, on palpation you can see the warmthness. Okay, along with that there might be a pus formation in the insertion site. So these three are the main symptoms of CLABSI. Along with that, in case of elderly patient or critically ill patient, you can also notice altered mental status. Okay, in case of severe condition, patient might land up in sepsis or septic shock. So these are some of the signs and symptoms what a patient might exhibit. Okay, so how can we prevent CLABSI? What are the preventive measures we have? Okay, first one is hand hygiene. Okay, as we work in a hospital setup, it is very important to practice hand hygiene. Wash hands before and after touching the patient. Whenever you are touching the patient, before and after, whenever you are performing any sort of procedure, make sure you are performing hand hygiene properly, so that you are not transmitting any of our infection from one person to another person. Second one is sterile barrier precautions. Always use gloves, mask or sterile glove and full draping if possible, in order to prevent the cross infection. Third one is chlorhexidine skin antisepsis. Disinfect insertion site with chlorhexidine. Okay, whenever you are doing dressing, especially when a patient is having a central line, every 7 days we are supposed to do the dressing. Okay, we are supposed to change the dressing. During that time, it is recommended to use chlorhexidine, so that all the bacteria will not grow and it will disinfect the bacteria. Okay. Prompt catheter removal. Remove catheter as soon as they are no longer needed. In the sense, when you analyze or when you notice that patient is coping up with his status, and when this catheter is not required, make sure you are removing it as soon as possible, so that there won't be any complication, or you are not giving any chances for the infection. So second one is COTI. Catheter associated urinary tract infection. It is a urinary tract infection in a patient who has catheterized within past 48 hours. Okay, once the patient have admitted to the hospital, patient might have come across different problem. Along with that, he might also has some bladder problem. Okay, voiding issues. If patient is encountering any of those issues, we usually insert catheter for urinary drainage. Okay. So in that case, if you are not taking care of that catheter properly, then he might land up in COTI. COTI is the most common HAI and it makes up to 32% of all HAIs. When you identify, or if you enlist the types of hospital acquired infection, COTI stands in the first place. It is the most commonly acquiring infection in the hospital. So how can you identify the patient is having COTI? Okay, as I said in the previous slide, when our body identify there is a presence of bacteria, obviously it will try to kill it by increasing the body temperature. So patient will start to exhibit or show the signs of fever. Okay, along with that, tenderness can be observed in the suprapubic region. Urinary urgencies will be there, dysuria, burning sensation during urination, cloudy or foul smell urine, and sepsis in case of severe cases. So these are some of the signs and symptoms that patient might exhibit if patient is having urinary tract infection. So how it can be prevented? First one is aseptic catheter insertion. As I said, if patient is having any of voidal problem, we do insert catheter to drain the urine from the bladder. Okay, when you are performing that procedure, always make sure you are practicing aseptic technique, proper hand hygiene and follow sterile technique. Second one minimize the catheter use only whenever necessary and remove as soon as possible. Okay, if you notice that patient is not requiring catheter, then it is recommended to remove as soon as possible, so that we are not providing any chances for infection. Okay, third one is closed drainage system. Maintain a sterile unobstructed urinary drainage system. Okay, so most oftenly we can see, even though patient have the catheter, they are not able to pass the urine, which means there is obstruction somewhere in the drainage system. Okay, make sure there is no obstruction in the drainage system, and you can check the urine bag for the drainage of urine. Okay, if patient is having catheter and still patient is not performing or passing the urine, in the sense it suggests there is a block in the urinary tract. Okay, this has to be identified, and measures has to be taken for that. Daily catheter care, regular cleaning around the catheter site. Okay, it is recommended that twice in a day we have to do a catheter care. Okay, if you are not following that, then patient will land up in COTI. Antibiotic stewardship, avoid unnecessary antibiotic use to prevent the resistance. So these are some of the preventive measures what we have to do to prevent COTI. Third type of hospital acquired infection is surgical site infection. It is a type of nosocomial infection that occurs at or near a surgical incision within 30 days of surgery. Okay, about 22% of all hospital acquired infections are surgical site infection. How it occurs, in the sense, when a patient is undergoing a surgery either for the therapeutic or for diagnostic purpose. Okay, after the surgery, the preventive measures or the prophylaxis has to be taken properly. Okay, if they are not taking it, then eventually they will land up in surgical site infection. The surgical or the sutured area has to be taken care properly. So there are different types or classification of SSIs. First one is superficial incisional SSI. Infection involves only the skin and subcutaneous tissue. Here you can see or you can notice the infection will be only on the topmost layer of the skin or the subcutaneous tissue, and it will not spread to the surrounding one. Okay, in case of superficial incisional SSI. Second one is deep incisional SSI. As the name itself suggests, it is deep. Okay, it will extend into the deep soft tissues such as fascia and muscle. Okay, and the third one is organ or space SSI. Infection affects an organ or body cavity opened during an surgery. So these are the three different classification of SSI. So how can you identify the patient who have underwent a surgery is having an infection? So patient will start to show some of the signs and symptoms such as redness, swelling and pain at the surgery site, where he have which site he have underwent surgery. No, on that side you can see the redness around the area. Swelling will be there. On palpation you can see the swelling, as well as on palpating patient will be experiencing pain. Okay, all these three are the major symptoms of a surgical site infection. Purulent or pus discharge from the wound, which states there is a bacterial invasion and it is adverse or worsens. Okay, so fever and chills, as I have earlier told, whenever a body is having any sort of infection, fever will be there. Okay, delayed wound healing. Okay, the wound healing process will become delayed because of the infection. Arrhythmia will be there. So these are some of the signs and symptoms that patient might exhibit when a patient when he is having SSI. So how can we prevent SSI? Okay, so prevention of SSI can take place in three parts. Okay, first is pre-operative. Before undergoing a surgery itself, necessary action has to be taken, that is administration of antibiotics. Usually we give the test dose, after that we give the full dose. Once we analyze the patient is not having any reaction to the drug, we will give the full dose. Okay, so that is called as an pre-operative antibiotic prophylaxis. Second one is proper hand hygiene, strict adherence to the hand washing and aseptic technique. During the procedure or during intraoperative, maintain or stick to the adherent procedure or aseptic technique, and always perform hand wash or hand hygiene whenever you are doing any procedure. Third one is aseptic surgical technique. Maintain sterile instruments, gloves, gowns, surgical drapes during the procedure, so that you are not giving any chances for the infection. So these are some of the preventive measures. Other than that, monitor for early signs of infection. Once the patient have underwent surgery, it is not that our responsibility have been done. Okay, again daily we have to assess the surgical site where he have underwent surgery, in the sense if you are assessing daily only you can make a little difference also. For example, patient might have redness after the third day or fourth day. Okay, in that case you have to take a necessary action. Conduct regular wound assessment and intervene early if infection is suspected. Proper wound care and prompt removal of drains and catheter is recommended. Okay, when you are giving proper care for the wound, obviously SSI will not occur. So fourth one is ventilator associated pneumonia, shortly it is called as an VAP. Pneumonia is the second most common nosocomial infection after UTI. So first place stands for UTI, second place stands for pneumonia, and the third place stands for SSI. And a patient receiving mechanical ventilator support develops pneumonia after 48 hours of intubation. So signs and symptoms. What are the signs and symptoms a patient might exhibit in the sense? Fever and chills, increased respiratory secretion, that is prurient or bloody sputum will be there, shortness of breath and difficulty in breathing you can see in a patient, decreased oxygen level, that is hypoxia, you will notice a level hypoxia, abnormal lung sounds, on auscultation you can hear crackles or wheezing sounds. Along with that, patient will also experience chest pain and increased heart rate. So these are some of the signs and symptoms what patient might exhibit. So how can you prevent VAP? So there are some of the preventive measures such as strict hand hygiene while handling ventilated patient. Head of the bed elevation. We should elevate the bed from 30 degree to 45 degree. Why we are doing in the sense? To reduce the aspiration risk. Third point is oral care with chlorhexidine. Whenever you are giving oral care, you use a solution chlorhexidine so that it will reduce the bacterial colonization. Assess the need of sedation and early extubation. Okay, daily assessment has to be done, and if you notice that patient is not requiring the intubation no longer, then it is recommended to do the extubation early. Suctioning to be done every second hourly to reduce the risk of aspiration. So these are some of the preventive measures we use for VAP. Fifth one is MRSA, methicillin resistant Staphylococcus aureus. Okay, MRSA is one of the most common HAI and it is a life-threatening condition too. It is a staph infection that is resistant to certain antibiotic like penicillin, amoxicillin and methicillin. Okay, this is a sort of infection which is very resistant to maximum number of antibiotics such as penicillin and methicillin. So when a patient is having a MRSA, we have to be very careful and we have to isolate the patient because MRSA might be transferred either with a direct contact or through contaminated instruments also. So signs and symptoms of MRSA: fever, chills, pain at the incision site, pus or drainage at the site of infection, cough, shortness of breath, muscle or joint pain and fatigue. So these are some of the signs and symptoms what patient might experience. Okay, so how can you prevent MRSA, or what are the preventive measures you have to take in order to avoid MRSA? Okay, first one is strict hand hygiene. As I said in the previous slides, almost in all slides we have the first point as hand hygiene because hand hygiene plays a very important role in healthcare facility. Okay, wash hands with soap and water or alcohol based hand sanitizer. Contact precaution: use glove or gown when caring for MRSA infected patient and isolate the patient, as I said. Regular environmental cleaning: disinfect hospital surfaces, medical equipment and patient rooms so that there won't be any chance of cross infection from the infected person to the host. So far we have seen the different types of hospital acquired infection and we have seen the preventive measures also, but there are few universal preventive measures, okay, what we can follow in the hospital. First one is hand hygiene. Second one is use of PPE, that is personal protective equipment. It helps us to prevent ourselves also and it also helps the patient to not to acquire new infection. Proper sanitation, sterilization and disinfection. Follow aseptic technique so that there won't be any chances of infection. Safe medication administration. Always use single syringe for single patient. Do not use the same syringe for the another patient. Then it will be a complication. So along with that, early detection and reporting of any infection. Maintain care bundle. So when you notice central line and catheter and all, we do have a care bundle where we have few criteria, that is date of insertion, date of care. Okay, so when you are maintaining the care bundle, you can analyze whether when was the infection have been started. Okay, safe water disposal. minimize the use of invasive devices, continue education and training. Okay, even though we do all the procedures carefully, do hand wash, it is also important to train our new nurses or healthcare facilitators or providers, so that they will be having adequate knowledge regarding these conditions. So far we have come to the conclusion of today's session. Okay, so far we have seen what is the meaning of nosocomial infection or hospital acquired infection, which are the sources, different types of sources, that is endogenous, exogenous, as well as mode of transmission, direct contact transmission, direct and indirect, airborne, vector borne, as well as droplet, and we have seen the different types of hospital acquired infection. Okay, so nosocomial infection poses serious threat to the patient's safety, increasing morbidity, mortality and the healthcare cost. Effective prevention ensures better patient safety, reduces the complication, and it also improves the healthcare quality. So these are the references what I have referred to prepare these notes. You can go through this. Thank you.